Hello, my name is Dr. Dewan S. Raja. Today I will discuss about marijuana. Marijuana is a derivative of cannabis sativa. We have another cannabis that is called cannabis indica, very similar to cannabis sativa. So marijuana consists of leaves and parts of the plant cannabis sativa. Marijuana is smoked in cigarette called joints or reefers. Sometimes it is served with cookies or brownies. Hashish is the compressed resin form of cannabis sativa, and the hashish name is related to another English word called assassination. The primary psychoactive ingredient of cannabis is THC or tetrahydrocannabinol, and another one is the CBD cannabidiol. Marijuana works on the endocannabinoid system of the brain. We have some anandamide receptors. So it works on that system. It modulates the neurotransmitter like GABA, there is gamma aminobutyric acid and glutamate. It is a stimulant. It is a hallucinogenic, that means false sensory perception. Sedative, it has sedative action to depress person depending on the dose and the time of consumption. So multiple action with the same drug. What is the toxic dose? Typical marijuana cigarette contain 1 to 3% of tetrahydrocannabinol. Hashish oil contain 30 to 50% of tetrahydrocannabinol. Toxicity varies from person to person and is influenced by previous exposure and tolerance to marijuana. If you go to the pharmacokinetics, about 10 to 20% of ingested dronabinol, that is containing the tetrahydrocannabinol, is absorbed. Onset of effect reaches by 30 to 60 minutes. Peak action by 2 to 4 hours. Elimination half-life is 20 to 30 hours. You have to remember that cannabinoid metabolites can be detected in the urine for several days to several weeks. So what are the effects of marijuana use? It causes euphoria. People feel high, confusion, disorientation, tachycardia, and agitation. It may develop psychosis in vulnerable individuals. That means people with schizophrenia, they will manifest gross psychosis, and even some people who are vulnerable or psychologically weak, they may develop panic disorder. Increased appetite, conjunctival injection, red coloration of the conjunctiva, orthostatic hypotension, incoordination, slurred speech, stupor, ataxia because of cerebral dysfunction, and loss of judgment and road traffic accident is possible. So it works on the brain, on the cerebellum, brainstem, and on the nerves. Okay. Chronic use lead to amotivational syndrome. What is amotivational syndrome? A syndrome in which those who take up regular cannabis use are more likely to exhibit apathy, loss of ambition, and difficulty concentrating. Does it cause lung cancer? There is some controversy. Research papers are not sufficient to say it causes lung cancer, but it certainly causes bronchitis, emphysema, because specifically on smoking, smoking has always bad effect. And people who smoke marijuana cigarette, they usually take the breathe in and hold the breath for a long time, then they breathe out. So it is found that in case of joint or reefer marijuana cigarette, the smoke is depositing around 4 times more deposits on the lung than that of the regular cigarette. So at least 4 times more tar will be deposited in the lung because people's habit to take the breath from the marijuana cigarette and hold it and then breathe after some time. So that will cause deposition of 4 times the usual tar of a cigarette. Okay, sometimes people contaminate the marijuana to get more high. They contaminate with food or many other particles, may contaminate with some herbicide like paraquat. Contaminated marijuana may cause salmonellosis and pulmonary aspergillosis. Intravenous marijuana extract or hashish oil may cause DIC. DIC means disseminated intravascular coagulation, and renal failure, kidney failure, and DIC, disseminated intravascular coagulation. So this is the cannabis tree, and we get the marijuana from this part, leaf and flowering part. So if we